Welcome to the Wagging Tails podcast. This podcast is brought to you by Noble Canine behavioural specialists and dog trainers. We provide global online consultations and training, as well as physical training and behavioural rehabilitation within Singapore. On this episode, we have Dr. Amanda Sim. We go quite deep into allergies with regards to our dogs. So the information in this podcast is really, really useful. However, we did record this in the veterinary surgery, and as a result, there was a background noise that we couldn't turn off, and the sound quality is not as good as I would have liked. But please bear with it and enjoy the episode. On this episode, we have got Dr. Amanda Sim from Manly Vet Surgery, and we're going to be talking about dogs and allergies. So, with that, I'm just going to ask you, Dr. Amanda, to give us a little bit of an introduction of yourself.
Sure. Hi everyone. My name is Dr. Amanda Sim. I am a general practitioner vet. I graduated about 10 years ago now from Murdoch University in Perth. And I have been a GP vet in Singapore ever since. I currently am working in Manly Vet Surgery. I like dermatology is something that I have a personal interest in because it is a very common problem that we encounter here in Singapore. We see many dogs, some cats with allergies. Because I see how debilitating the condition can be, I feel it is very rewarding to be able to alleviate itch in that way, and owners are very, very appreciative when they see that their dogs are feeling much more comfortable. So over the years, I've developed quite a passion for this area.
So, it really is something that impacts a lot of dogs. I know for myself, we're actually sitting in your surgery with my dog Arus, who suffers from allergies. And when I see that he is doing better, his whole personality changes. He seems more himself, he seems happier. And with a lot of my clients as well, they might come to me for reactivity issues or aggression issues, if you like. And a lot of it boils down to the fact that your dog is so itchy and uncomfortable that their patience is super, super low. So it's not that your dog's got really an aggression problem, they've got a medical issue, which is why it's so important, and this is something I say to everybody, is before you embark on any behavioural shaping, make sure you've got your dog cleared by the vet. Because if there's a medical issue, the last thing we want to do is be putting them through a rigorous behavioural training programme. So even just with my experience with my dogs and my clients, it's such a huge issue. So it's a really important thing to be talking about.
Yeah, definitely. I think I've encountered many clients after we have kind of gotten to the bottom of their dog's allergies and they are much more stable. I feel especially dogs with allergies that manifest and they always get itchy and infected ears. I feel like that is a condition that's actually very painful and uncomfortable for them. And when it's been successfully treated, the dog is like a new dog. They're so much more comfortable, they're so much more active, they're so much more engaging with their family, and so I do think it really makes a big difference. I guess I would compare it maybe to people that have eczema and how they can really be very, very badly affected and affects their quality of life in a very big way. So I see it I guess in a similar way with dogs.
Yeah, absolutely. I don't think I've actually spoken about this before, but I know I've spoken about Athos. In the first episode, we go through his behaviour journey. But he used to get really bad yeast infections in his ears. And I'd imagine that would get a similar level of sort of discomfort and pain. And that definitely impacted him. Mm-hmm. So, just so that we're a little bit more clear in what we're talking about, because we talk about allergies, everybody kind of has their own interpretation of what an allergy actually is. So would you be able just to explain the basics of allergies and if there's any difference between how dogs experience allergies as compared to humans?
Yes, so we see, with, I guess usually the presenting complaint when an owner brings their dog in is, my dog is itchy. So that's usually kind of where we start. And with itchy skin, it's then a process of elimination to really kind of get to the bottom of why the dog is itchy. So there's a bit of a list to get through of different possibilities that we rule out one by one. And so usually we first investigate whether or not there are any external parasites. And so we test the skin, we do skin scrapes to check for mites. And so that's usually the first thing. We usually collect samples to check for infection because infection also contributes to itch. The infection most of the time is usually a secondary problem to an underlying problem such as allergies, but we have to treat that as well. Then right at the bottom of the list would be allergies. So there are there's three more common allergies. So the first would be a flea bite allergy. And so there are certain dogs that are very, very sensitive and allergic to the saliva that is produced by the flea. And so if they are not on flea prevention, and if they do get bitten by a flea, so when the flea bites, it injects a little bit of saliva into the skin, and if that particular dog is allergic to it, they will then become very itchy. So that's one type of allergy. So usually we investigate that by putting them on what we call a flea trial. So there are certain medications that can be used for that purpose. So we treat them with flea prevention, and we then give them, kind of 1 to 2 months and see how they respond. So that's one type of allergy. The two, I would say, more common types of allergies we see would be what we call atopic dermatitis. So that's an environmental allergy. So that we're referring to things like things in the air that we can't see. For example, they are outdoor and indoor allergens. So outdoor allergens would be referring to things like pollen from the grass and the trees. That's a lot of dogs are allergic to those things. In the indoor environment, there are house dust mites, there are mold spores. Some dogs can be allergic to insects as well. For example, cockroaches, mosquitoes, ants. So those fall under environmental allergies. Lastly, another type of allergy would be a food allergy. So these are dogs that get itchy skin whenever they eat something that they are allergic to. So a food and environmental allergy is a type of hypersensitivity reaction that usually involves an antibody called IgE, but it can also be mediated through other means. And so those are very common allergies that we deal with in clinical practice. There is also a very, very uncommon type of allergy, which is a contact allergy. So with a contact allergy, that animal is allergic to something that they are touching. So a lot of people would come in and ask, could it be the floor detergent that I'm using that my dog is allergic to? So a contact allergy in practice is very, very rare. In fact, I don't see, personally, I've not seen actually a single case of that. And so usually I would investigate the other types of allergies first, just because they're more common.
Okay. One thing that I have seen with contact allergies is because they're so rare, people don't tend to even think of them. I was working with a dog that had really bad rashes on their stomach, and they kept going down that allergy route. But it wasn't actually the fact that the dog was allergic, it was because the floor cleaner they were using was so strong that the chemicals were actually burning the dog's belly.
Yes.
And a lot of people were like, so they were allergic to the floor cleaner. And I was thinking, well, not really. I mean, anybody that lies on that floor cleaner is going to get burned, is going to get a rash.
Yes.
So it's important to understand that just because contact allergies are rare doesn't mean that it can't be something else that they're in contact with causing that issue.
Yes, definitely.
And the other thing I wanted to ask there when I was hearing you talk about that, a lot of the time you get dogs out in the tropics who are allergic to the grass pollens and grass mites and things like that. Very rarely have I ever seen that in temperate climates. Is that just because of the different types of grass, do you think? or is it something else?
That's quite interesting. I guess I don't have a lot of personal, um, information about the prevalence of pollen allergies in temperate countries. Although I am aware that allergy testing is present in many temperate countries, the allergens that are tested for are actually different. So the panels are different and they are specific to that region. Because the climate is very different, we have different flora and fauna, and so we see very different types of pollen. And so the testing should be specific to that region that the dog is living in. So I feel like because we are in the tropics, it is very hot and humid, and so I feel like that in itself is kind of not helpful for skin in general. I do think that is a factor why we do see a lot of skin cases here. I mean, also another thing is because allergies are heritable, so there is a very big genetic component. And so breeding also is a big factor. So whether or not that is also kind of in play. The same kind of genetic pool is in a particular area. And so it's just, being passed on from one generation to another. Maybe that's also a factor.
Sure. I mean, unfortunately, in the tropics, and in Singapore especially, you've got a lot of basically puppy mills.
Yes.
Where they're not ethically changing the genetic panels.
Exactly.
So that definitely have an impact. And even for our street dogs, our Singapore specials, that we like to call them, the genetic pool for them is getting smaller and smaller and smaller.
Yes.
Because more and more of them are being homed and captured. So it means that genetic pool is also getting smaller.
Yeah, definitely.
So that makes a lot of sense. I guess the other thing is that the heat in general, it means if you have an allergic reaction in the heat, it gets a lot worse than it would do if you were cold.
I would think so, because there is a lot more chance that the skin remains moist. Especially if there's an infection and there's discharge, from the skin, because of the humidity, it doesn't kind of dry out as well as in a temperate country, I would think. So I do think that the climate is a factor in some sense.
Okay, yeah, it's interesting. So let's talk about how we identify the allergies themselves. So we know that there's the symptoms of itchiness and things like that. For the different types of allergies, are there different symptoms? Or is it a case of having to do testing and trials? And effectively, you spoke about the overview of how you test, what you test for first before the allergies. But how would you actually test the allergies themselves?
Yeah, so that's a really good question. So for a flea bite allergy, there could be a pattern to fur loss and the area that the dog feels itchy. So it tends not to be quite symmetrical. More often over the thighs, sometimes over the flanks as well. And so that's a flea bite allergy. With a food and environmental allergy, just by looking at the dog, you are not able to differentiate them because the same parts of the body are affected. So quite typically, they would be chewing and licking at their paws. The area kind of like under the neck would be affected. They quite commonly get ear infections. Sometimes you get more pigmentation and redness around the eyes. They tend to scratch at their muzzle. Armpit and groin area can be quite problematic as well. So the pattern of distribution is exactly the same, so you're not able to tell them apart. So when we're investigating allergies, firstly would be to rule out, external parasites, infection, and all that sort of stuff. Then we kind of get to the bottom of the list with allergies, and so with the flea bite allergy, would then put them on flea prevention. To diagnose a food allergy, there is no escaping doing what we call a food trial. So that's an elimination diet. So the gold standard recommended is to do a single protein, single carbohydrate, home-cooked food trial. And so that's what I would usually recommend. We do it for 6 to 8 weeks, where the diet is very, very strict. We try to avoid doing a food trial with commercial diets because the thing is, you see a lot of cross-contamination between different types of diets. And so with manufacturing a diet, it is virtually impossible for the manufacturer to clean, the machine such that there is zero food left. And so when different flavors are made, different brands are made, there's a lot of mixing. And so even though you look at the list of ingredients and it may say a certain thing, but there's a lot of other stuff that may be in there unintentionally. So that's one thing. Doing a food trial, sometimes we may reach for what we call prescription hydrolyzed diets. So these are vet prescription diets. And by hydrolyzed, what that means is that the food particles within the kibble are cut up into really tiny pieces to a point that they are not meant to trigger a reaction. So usually I would reach for those if I'm dealing with a very young dog. For example, if it's less than a year old, I want to make sure that it is still on a balanced diet. I would probably reach for a hydrolyzed diet. But if I can help it, I always recommend a home-cooked, novel protein, novel carbohydrate diet, because then we are absolutely sure what you are feeding the dog and there's no chance of cross-contamination. And so the food trial goes on for about 6 to 8 weeks. After this period of time, we then do what we call a re-challenge. So we will then feed the dog the diet it was taking before the elimination diet, and we monitor them for about 2 weeks to see whether the symptoms of the allergy comes back. So do they start to chew their paws? Do their ears flare up? Do they get a rash again? If that happens, usually within the 2-week period, then we can safely say that that dog has a food allergy. And so that's how we diagnose a food allergy. With an environmental allergy, what we usually do is what we call a treatment trial. So we put them on medication that helps to treat an environmental allergy, and we see how they respond. And if there's a good response, we would then try and stop the medication to see whether the symptoms come back. So that's what I usually do. There is also the option of blood tests. For a food allergy, blood tests for food allergy actually is not accurate. There are what we call reactivity tests available. So these blood tests do not diagnose allergies. What it does is it shows us the reactivity of the dog to certain food items. So the lower the score, the lesser reactive that dog is supposed to be. And so that should be a relatively safe item to feed the dog. So that's how we use that result. So it doesn't work in the sense that there is a threshold, say, for chicken, it has a score of 1 in 10. That means that dog is allergic to chicken. So we do not interpret the test in that way. So there is also blood tests and skin tests available for environmental allergies. And so a whole list of allergens are usually tested for. We always correlate those results with clinical symptoms. So the dog must show symptoms of usually having itchy skin, usually in that pattern of distribution that I mentioned earlier. And we look at the allergy testing result and we correlate that. So what this means is that if you test any dog, even a dog with perfect skin, you could get some positives, but that does not mean that that dog has an allergy. So that dog needs to have symptoms before you actually do the allergy testing. And the point of doing allergy testing, and I think we'll go into this a little bit more later, would be to then try and desensitize them.
Yeah. So we'll talk about that a little bit later. I mean, for Aramis, we've done food trials and the testing, the blood tests. I found the food trials were quite challenging.
Yes.
So it's the same sort of thing with my day. We talk about what the perfect scenario would be for training or behavioural shaping. But the reality of life is that you're not going to get the perfect scenario.
Yes.
So, for example, even at the moment with Aramis, he's supposed to only be on pork because his novel protein. But the moment my daughter is eating, she's now at the stage where she calls him over to give him food. And it's really difficult to actually keep that so strict.
Yes.
So I guess that's why the desensitization and the longer term medication comes in.
Yes, yeah. So I guess we try our best to be as strict as we can with the food trial, but there are many different scenarios in in which case it is near impossible. So I always tell people just try your best, to do that. If they say I just can't manage, say they have members in the family that feed them food off the table, and they say it is really impossible to stop. Then I would say then we might not want to do a food trial because then the result could be inaccurate. If it's not that strict, then what I usually recommend is to have a kind of more stepwise approach. Maybe focus on a possible environmental allergy first and kind of deal with that. Then we see, how the dog responds. If you get a very good response, then it suggests that maybe there isn't a food allergy present. But if the dog doesn't respond that well or as expected to treatment for a presumed environmental allergy, then we may have no choice but to really kind of relook at a possible food allergy. So that's also another way to approach it.
So one other thing that we did try with Armis was the immunotherapy or the desensitization. And we found that we went through the course of it and we found that it didn't seem to have the results that we were hoping.
Mm-hmm.
And we actually ended up having to continue him on his special diet to ensure that he's manageable. And obviously now, you've just looked at him, his skin's looking really quite good.
Yes.
But that means that even like the most like scientific way of doing this, if you like, with the immunotherapy, that's not 100% going to work, is it?
No, it's really not 100%. I mean, I don't think anything is 100%. I think you get the best result when you do a combination of different things. And so that's, I guess, what they call a multimodal type of approach. So with allergy testing and desensitization, so this is only referring to environmental allergies. The success rate, I feel, is probably about 50 to 70%. And so I would still recommend it, especially for younger dogs, because they have a very long life ahead of them. So the only way to try and cure them of their allergies, to successfully desensitize them, would be to do immunotherapy. And so what this involves is you do the allergy test. So for example, you've done a blood test or you've done a skin test, and you know exactly what allergens in the environment your dog is allergic to. The next step would then be to order in immunotherapy. So for example, if your dog was allergic to house dust mites, you would then order in the house dust mites and put it into immunotherapy and expose your dog to it on a regular basis, starting with a low dose, and you kind of increase slowly over time. And this is done on a regular basis. So I usually tell people upfront to give immunotherapy about a year at the very least, to see whether or not their dog responds to it. By response, usually what I tell people to look out for would be decrease in itch, and also I guess with how the flow works is, for the first 2 months of immunotherapy, I still keep them on their daily medication. Most of them are already on daily medication, because if you were to stop medication at that point, they would usually flare up because there hasn't been enough time to be desensitized. So we give them 2 months. After 2 months, assuming everything is all stable, they are on their daily medication and they are on immunotherapy, that's when I would try to taper the medication. So instead of having to give it every day, they would give it on alternate day. Maybe we give them another couple of months. And so we wean them off medication slowly. So we're trying to cure them of their allergies, and we're trying to get them off long-term medication, because any long-term medication that you take, although the options that we have now are really safe, but we would like to try to avoid it as much as possible. Yes, so that's about immunotherapy. So I guess I've seen a whole range of responses to immunotherapy. I have seen them not respond, I guess similar to Aramis, where you start them on immunotherapy, but you just cannot get them off medication, no matter how many times you try over, say, like a 1 year period. If that were the case, I would then say, okay, I think we've given it a fair try. It doesn't seem to be helping that much. If they're still needing daily medication, and we've tried this for a year, then I would say, okay, maybe let's just stop the immunotherapy. And if they're stable on medication, we would then just continue them on medication. I've also seen the other extreme where they manage to be completely off medication and just on immunotherapy alone. I have also seen a few cases that were successfully desensitized. So they were actually able to stop immunotherapy at some stage and still be okay. But I would say, from memory, I think I've only seen it once.
Okay.
Yeah.
I mean, the other thing is some dogs grow out of it. I mean, these dogs used to get quite bad allergies in his like eyes and his muzzle.
Mm-hmm.
And then we didn't change anything really because it didn't bother him that much.
Yes.
And it just disappeared over time.
Yeah, I guess it could be well that he has desensitized himself.
Mm.
I mean, if he continues to be exposed to the allergen, maybe over time, his body has just decided not to be allergic to it anymore.
Because am I right in saying that allergies are just your immune system overreacting
Yes.
to the stimulus?
Yes.
Yeah,
Right.
so
Yes.
it's something that it's not actually the stimulus that's causing it, it's actually your own immune
Yes,
system.
exactly. Yes, that's right.
Mm-hmm.
Yeah, so if you see the same thing often enough, you're hoping that your immune system will actually develop an immunity to it. So dogs that respond well to immunotherapy, owners would actually feedback. When they administer the immunotherapy, they actually see that it has an anti-itch effect.
Mm.
So that's also something I tell people to look out for.
Well, that's the Indiana Jones thing, isn't it? Getting a little bit of snake poison continuously, eventually getting bit in your thigh.
Yeah.
For the record, I don't think that's actually accurate. Nobody do that. So, just to go back to practicalities as well, we're talking about immunotherapy, we're talking about long-term medication, we're talking about food trials. Now, I can say this very confidently from experience. Immunotherapy is expensive.
Yes.
Medication is expensive.
Yes.
Food trials are expensive because a lot of these novel proteins are things like crocodile, kangaroo, frog.
Yes.
It's not just proteins that you can go out and buy easily.
Yeah.
And on top of that, you've got to be consistently aware of what you're doing.
Mm-hmm.
So it's not an easy journey
No.
for the
Definitely. Yes. Yeah.
And what would you say if somebody was really struggling with cost? Because as much as I know there's a lot of people out there that say, well, if you can't afford it, you shouldn't have a dog. But when you get a dog, you don't expect to have to fork out thousands and thousands and thousands on things like this.
Mm.
And pet insurance only covers so much.
Yeah.
So is there anything else, such as lifestyle changes or prevention, that people could be aware of or people could try and implement, even if their dog's already showing signs of allergies, but they know that maybe they'd be able to go on a short course of steroids to help get rid of the itch, but longer term, they're not going to be able to fork out $600 a month for the medication.
Yes.
And that kind of thing.
Yeah, so I guess it would be good to maybe try and observe if there are certain triggers to your dog's allergies. So, for example, some dogs with a pollen allergy, owners would say, they notice every time their dog goes out and goes onto the grass, it seems to trigger the allergy, so they get really red or they get really itchy. So if that was happening consistently, it would suggest that there is a pollen allergy going on. So I guess making some observations to see whether you can try and pinpoint exactly what the allergy is. Another example would be dogs that have a house dust mite allergy. Something that will be quite helpful would be to vacuum regularly. So anything at home that can trap dust could harbor house dust mites. For example, carpets, bedding, fabric sofas. So I would then recommend more regular vacuuming to just reduce the dust mite burden, and sometimes that can actually improve the symptoms.
So things like, obviously, vacuuming, air purifiers, switching to a leather sofa, short pile rugs, or things like that. That's all something to really think about.
Yes, definitely.
I mean, it's also a good idea to vacuum the house regularly with dogs anyway.
Yes, true.
If we don't vacuum our house, if the 3 boys in one day, it looks like we've got a carpeted house.
Yeah. I guess also many people have dogs that don't really share that much,
Yeah.
so then they may not need to vacuum that often. But it can be very helpful.
Or only one dog. That's also helpful.
Yes. What other ways to help? So other things that could help. So back to the kind of multimodal approach would be topicals. So that can be helpful. So using medicated shampoos regularly can help to reduce some of the bacteria or the yeast of the skin. Cleaning ears once in a while. And what else? The other thing I was going to say would be certain supplements. So things like omega-3 fish oils, I highly recommend because they have a proven benefit in helping skin. It's anti-inflammatory, it increases the moisture of the skin, and things like that. So things to improve, the integrity of the skin barrier, that there are topical products that can help with that. So I guess it is a good idea to start with those things first, because they're usually very safe, easy to do, not terribly expensive. That would be a good place to start and kind of see whether that has any improvement or not.
Okay, great. So what I'd like to do now is, normally we do the listener questions at the very end, but this topic is something that a lot of people struggle with. Somewhat similar to the one that we are doing without our guests, and we're talking about reactivity and aggression. So basically what I've done there is I'm holding off the questions till we've done all 3 episodes on that topic. But for this one, we got a lot of questions emailed in. We had a few in the comments and different social medias and things like that. So if it's okay, I'd like to take the time and just go through these questions.
Yeah.
Okay, so the first question is from Jamie, back in Scotland. Can certain dog breeds be more prone to allergies?
Yeah, so that's a really good question. Definitely, yes. We see certain breeds, just because allergies are genetic by nature. And so we do see it in some breeds more often. So some examples to cite would be West Highland White Terriers, usually a big one. In Singapore, we see a lot of allergies actually in Singapore Specials, which are mixed breed dogs. So those can be quite prone to allergies as well. So yeah, the answer would be yes.
So yeah, I mean, we kind of touched on this earlier when we came to the street dogs, the Singapore Specials. It's probably because of the genetic pool. It's important for people to understand, as much as we so affectionately call them Singapore Specials, they're not actually one breed. And as much as there is a limited genetic diversity which is happening for the allergies, they're actually quite genetically vast with regards to the breeds, if you like.
Yes.
So that's an interesting one.
Yeah. Okay,
Annie in Singapore. Are there any over-the-counter or holistic medication I can give my dog?
Yes, so as I mentioned earlier, so things like omega fish oils are very good for the skin, so I highly recommend trying that. With holistic medication, I'm Western trained, so I guess I don't have a lot of experience with things like TCM for skin or homotoxicology remedies. So these are also kind of natural alternative remedies that some vets do use that to treat skin problems. So they don't actually contain medication per se, but natural ingredients. So those are also options. Topicals would be another big one that you can just buy over the counter. So medicated shampoos, sprays, wipes, washes, creams, things like that. You could also try those just over the counter as well.
Okay, great. This one's from Kirsten in Singapore. What steps can be taken to help grass mite allergies?
That's a good one. So it's really honestly quite difficult to avoid them altogether, because I feel like that has a big impact on the dog's quality of life. So a dog should go out for walks. have a sniff. And so that's and so kind of some people will say, oh, what if I keep my dog at home all the time? So yes, it may help because there's a bit less exposure, but I usually feel that we assess the dog's quality of life as a whole, and if that dog really enjoys going out, having a run on the grass, I feel personally quite sad to just kind of withhold that from them. So it's very difficult to avoid pollen, to be honest.
One thing I would say on that as well is that as much as keeping the dog at home would solve the allergy issue, it's the same as when you suppress a behaviour.
Mm.
If you suppress a behaviour instead of actually solving it, there's a different behaviour can pop up elsewhere.
Mm.
So if you're keeping your dog at home, you're solving that allergy issue, but now your dog's not being enriched and engaged to the level they should be.
Yeah.
So the chances are you're going to start getting more behavioural issues.
Yeah.
Not just because they aren't reaching their activity level for each day, but also because they're now not socialising.
Mm-hmm.
They're now not exploring.
Mm-hmm.
And all of these things can lead to real behavioural issues that people end up struggling with.
Yeah, definitely.
So I'd like to make sure people don't feel tempted to do that because they think it's an easy fix.
Mm.
They'll fix one problem, but another one's definitely going to pop up.
Yeah, for sure. Yeah, fully agree with that.
So with that one, I'm guessing that it's very difficult to help grass mite allergies if you're still letting your dog be a dog.
Yeah, I mean, I would say then to really consider treating the allergy.
So long-term antihistamines, things like that.
Antihistamines, there are actually now quite a few options for treating environmental allergies in terms of medication. So Equipel is an example. I'm sure many people are very familiar with that. Aramis is on that. So Equipel is licensed to treat allergies. And it is not a steroid, so you don't get all of the kind of steroid side effects associated, which is good. And recently also has been found to be actually quite safe when used long term. So I would consider medication to try and manage the allergies. I think that's important because for me the priority for treating allergies is to manage itch, because itch is the thing that affects them the most. If you alleviate itch, they feel much better, and the skin doesn't get infected, and so they don't need repeated courses of antibiotics and antifungals, which then also have long-term repercussions.
Mm-hmm. So I guess that's also a very similar question to Sukriti, who asked how to cope with environmental allergies and how to reduce allergen load while still going for outdoors and hikes. It's the same answer really, isn't it?
Yeah, and also to consider allergy testing and desensitizing.
Mm-hmm.
So with desensitizing, you are introducing the allergen in a very controlled way. And so the body hopefully can develop immunity after a while, and hopefully if they are successfully get desensitized, they can go and run about and not have a reaction.
Yeah, I mean that's the dream when you've got dog allergies, isn't it? To get 100%.
Yeah.
Okay, this next one's from Alex in Melbourne, Australia. Is it possible to completely cure allergies in dogs?
Mm-hmm. Yeah, so yes, definitely for environmental allergies, desensitizing would be the only way to really cure them of allergies. With a food allergy, usually I recommend to avoid the food item that triggers a reaction. You don't really kind of expose them to it regularly, hoping that they will be cured after a while. So really to avoid, if you avoid what triggers the allergy, because it's not easy to do with food, because their diets are pretty well controlled. We decide what to feed our dogs, so to just completely avoid feeding them what they're allergic to. But yeah, definitely for environmental allergies, the only way to cure would be to desensitize.
Good luck. Okay, and then from Ashwin in Singapore. My dog's ears are red and itchy. Is this allergies? What else could it be? So we kind of touched on that earlier on. But
yes, so many dogs with allergies do have red and itchy ears. So even though it is a different part of the body, but the inside of ears are lined with skin as well. So it is actually part of the same organ. And so many dogs with allergies will get recurrent ear infections. But I would say that not every dog that has an ear infection has allergies. So usually we would try to collect some samples from the ears to identify whether or not there is an infection. We would then try and treat it with topical medication and regular cleaning. If we feel like, the infection kind of keeps coming back, and if it also manifests in other parts of the body, so they're chewing their feet, they're getting rashes in other parts of their body, quite likely they have allergies, and that's why they have ear infections. But there also could be other reasons for red and itchy ears. So if, say, they have a polyp in the ear, if they have a rose in the ear that is physically obstructing stuff from getting drained from the ear, then the ear will be very prone to infection. So the dog does not have allergies, but it manifests in a similar way that they get frequent ear infections. So I would say not every dog with ear infections have allergies, but most dogs with allergies may get ear infections.
Okay, I guess it could also be things like bacterial infections, yeast infections, things like that.
Yes, and also I must say ear mites. Yeah, so ear mites are also some, so these are external parasites that are contagious. So a dog will pass it to many other dogs that it comes into contact with. And so ear mites actually cause them to be really itchy. So usually with that, you see really dark discharge coming from the ears, and they are just scratching and shaking their heads nonstop. So that's also something that's separate from allergies. So very treatable though.
Sure. And I'd also imagine things like that, it's the more moist and warm the ear is, the more likely they are to get it. So just to keep it simple, dogs with floppy ears are probably more prone to get these kind of things than dogs that have not.
Yeah, so that's quite a controversial point. I think there has been a lot of research. So a group of people will do research and say, yes, having floppy ears do predispose to ear infections, but then another group will then come with other data and say that, actually that's not the case. So I feel that there's a lot of kind of back and forth with that. What does predispose to ear infections would be very hairy ears. So certain breeds have really hairy ears. Ears getting wet a lot of the time. So certain dogs, if they swim very, very regularly, they always get water going into their ears. It can predispose to ear infections. So I would say those two things. But whether or not the ears are floppy, I feel like if they do have allergies, so that's more like a bit of a breed thing, which then ties into the fact whether or not they have floppy ears, have a bigger impact as opposed to whether the ears are floppy.
Okay.
Yeah.
Okay. Okay, Doc. So before we completely wrap everything up, have you any practical advice, closing thoughts, steps that you've maybe not spoken about yet to give people advice if they're thinking their pet might have allergies or if they know that their dog has allergies?
Yeah, so I would say to always get a vet's opinion on whether or not your dog has allergies. So I would say dogs with allergies, just as a general rule of thumb, usually manifest quite early on in life. So you usually see them start to develop symptoms within the age of 1 and 5. So that's a bit of a telltale sign. The distribution of symptoms, is also another big one. And so there is also a whole range of severity when it comes to allergies, from very mild, where they may get a bit of a rash maybe once or twice a year, to the more severe cases where on a day they don't get their medication, they will start to flare up. And so I always treat based on how severe the problem is. So not every dog with allergies needs kind of the full workup, because like what we've discussed, it is a rather long, involved and costly process.
Yeah.
So I always treat based on how bad the problem is. And also, I guess a big thing would be how far do owners want to go? What is their approach, to long-term management and investigating? So there are, I guess, many different factors that go into how we manage a case.
Yeah, great. I mean, the other things I would just like to point out before we wrap up is just to emphasise how important it is that as much as there's a lot of great information that we've just spoken about, if somebody's out there that's struggling with allergies with their dog, please go to a vet. Don't try to manage it yourself. Don't try to buy medication online or anything like that. Go to your vet and get appropriate help.
Yeah, one thing I must also add is that a lot of people come to me and they will say, I know my dog has allergies, but nothing can be done about it. So I guess there's also maybe a little bit of a lack of awareness that there are actually many options available to diagnose and to manage allergies long term. So when I kind of go into it, then people I guess are pleasantly surprised that there are actually options. Your dog does not have to live with allergies. And so that makes it really sad when they don't know that actually, things could be much better. So yes, I do agree. Always, get a vet's opinion because there is so much that can be done.
I can completely relate to that because a lot of the time you meet people that have got very skittish dogs, very nervous dogs, and people are just so quick to say, oh, that's just how the dog is. There's nothing that can be done, which is just simply not true. And your dogs like allergies. If your dog is suffering from allergies or if your dog is anxious and very nervous, their quality of life is being affected. They're not having as good a life as they could do. And because of the stress of that, it could potentially shorten their lives as well. Mm-hmm. The stress is incredibly impactful. Mm-hmm. So it's something I can very strongly relate to. And I'm sure that you see similar things coming through here as well. Mm-hmm. The other thing I just wanted to point out was if your dog is showing any signs of allergies, or even if they're not, if their behaviour starts to change from the norm, get them checked by your vet, because dogs don't just all of a sudden decide to act a different way. Mm-hmm. They're not that changeable. And if there's a medical reason, whether that be allergies or something else, it's paramount that that gets discovered first. Mm-hmm. So I just want everybody to bear that in mind as well, because as much as we're talking about allergies here, if we went on about what other things could be affecting our animals, it would be about a year-long podcast, I'm very sure.
Yeah.
So, with that said, I just want to thank you for being on this episode. It's been really interesting. I'm sure a lot of people have got some good information from here. How can people find you, and how can they contact you if they want to reach out to you for professional advice or for the clinic itself?
Sure. So you could check us out on our clinic website. So nambivets.com.sg. There is a section to make an appointment. So that's one option. You could message us on our Facebook or Instagram accounts. I would say the quickest way to get in touch with us would be to pick up the phone and to give us a call. If the clinic is open that day, your call will be answered. So if it's something urgent, just pick up the phone and give us a call.
Okay, great. So we put all of that information into the show notes as well. And then when we share that out, I'll share the link with you and you can do the same. I just want to encourage everybody listening to stay informed about their pet's health and well-being. Don't just assume that your pet suffering from something is just the norm. Please always get it checked. Please make sure you're doing everything that you can to ensure that they are the happiest and healthiest they can be. Because at the end of the day, we are the ones that have introduced these animals into our house. They didn't ask to come in here, so it's our responsibility to look after them to the best of our ability. And just before we go, I just want to let everybody know that the last episode we did was episode 1 on dog aggression. The next episode for that is going to be coming out on the 15th, and then again the subsequent month after that for the 3rd. So if you've got any questions about canine aggression, please email them into us or message us on the website or on the social medias, and we will be able to include those in that 3rd and final episode. We also would like to ask you guys to like and share this podcast. I'm sure, especially with episodes like this, we're getting some good information on here. And I also just want to let everybody know that Noble Canine in the fairly near future is going to be growing, and we're going to be doing a lot more online courses and coaching, and we're going to be launching an online community, both a public one and a private one for members. So everybody listening, if you're interested in joining that, please look out for it on our socials and sign up so that you can have access to the weekly Ask Me Anything sessions, which are live sessions where you can ask anything with regards to your dog's training or behaviour. And eventually what I'm hoping to do is get guests onto these Ask Me Anything sessions so that we're also able to get specialists that can answer questions like veterinary, like nutrition, like rehabilitation, all that kind of stuff on there as well. So watch out for that. I hope you've enjoyed this episode. So until next time, guys, have a good one. Cheers.